You've just undergone a coronary angioplasty. Let's talk about some of the details surrounding the procedure, along with actionable items you can take to make for a strong, speedy recovery. Your physician likely performed this procedure as a result of a buildup of fatty particles in your coronary artery, the kind of vessel that supplies blood containing nutrients and oxygen to your heart muscle. When too much fat builds up, the passageway for blood to flow through the coronary artery shrinks, and this is very harmful to our hearts. As a result, your physician performed the coronary angioplasty to widen the passageway for blood flow to your heart. Prior to the angioplasty, your physician used imaging coupled with dye to identify the precise location of the constricted artery. Then, in the angioplasty, your physician inserted a catheter containing a balloon at the tip into either your wrist or thigh. The catheter was pushed through your blood vessels up to the constricted region of the coronary artery. Once at the constricted location, the balloon tip was inflated, thereby widening the artery. Following an angioplasty, we will most likely be prescribed anticoagulants, commonly referred to as blood thinners, to prevent blood clots from occurring. Clotting, which occurs when blood cells clump together in blood vessels, occurs more frequently in individuals who've undergone angioplasties, especially if a stent was used. As a result, we want to ensure that we follow our physician's orders with regards to blood thinners. While on blood thinners, we must be very careful to avoid any significant bodily impact. In particular, we need to ensure that we do not fall or hit our heads. Should you fall or sustain significant bodily impact, make sure to immediately contact your doctor and, just to be safe, head to the nearest hospital for examination. Once we've returned from the hospital following an angioplasty, we need to take a couple of steps to ensure a healthy and speedy recovery. Namely, it's important to engage in some non-intensive exercise, such as walking around and spending time outside, upon returning home. Additionally, because dye was injected into our bodies, we need to ensure that we drink lots of water to help push it out quickly. Try for 8 to 10 full glasses of water per day for at least the first 2 days post-op. To prevent swelling, we should ensure that we raise either our wrist or leg, depending on where the catheter was inserted. In the time following discharge, we may notice some bleeding or bruising at the catheter insertion site. Normally this is okay, and it's good practice to apply pressure at the site to prevent further bleeding. However, it's important to watch out for serious profuse bleeding. Should this occur, notify your doctor and head to the hospital. While these represent actionable items, there are some actions we need to refrain from following angioplasty. For example, we must refrain from driving for at least 24 hours post-op, only returning to driving when we feel safe and when our doctors inform us that it is safe to do so. If the wrist was used as the site for catheter insertion, we need to ensure that we are not overusing our wrists in the time following this procedure. For at least 48 hours, or until our doctors say it is safe to do so, we should avoid lifting heavy objects and refrain from vigorous wrist motion. Additionally, avoid using any creams, lotions, or ointments at the wound site. Also, the first week following the procedure, refrain from submerging yourself in water, like in a bathtub or swimming pool. Generally, it's okay to shower, though we should ensure our wound site is not under constant water pressure. But we want to avoid entering a standing body of water for the first week. Finally, remember to refrain from any strenuous exercise in the days following the procedure, and check with your care team prior to partaking in more physically demanding activities. Oftentimes, following an angioplasty, we will be sent home with a wound dressing over the catheter insertion site. It's important to remove this dressing the day following the procedure. In order to remove the dressing, first wet the tape over the wound and then carefully peel the dressing away. Once removed, it's generally good practice to clean the insertion site once a day. Just place soap on the area and gently wash the site. Careful, it's important that we're gentle when tending to the insertion site, making sure to avoid vigorous rubs. When we're not actively cleaning the insertion site, it's critical that we keep the insertion site dry. Remember, clean and dry and you'll be fine. In the rare event that you have chest pain, shortness of breath, and/or dramatic changes in mental status, call 911. It is very common for patients who have undergone coronary angioplasty to feel depressed about having heart disease. Recognize that if you feel this way, you're not alone, and these feelings are very normal. Know that there are people who care about you. Reach out to people in your community, friends, and family, and remember that your care team is always there to support you as well. Thinking about the future, plan to eat healthy and engage in consistent exercise. This way, we can take charge of our heart health and go on to live healthy, strong lives.